dear friends. Good evening. Today I'm back again with the next topic, which I had promised I would be back soon. This time it's an obstetrics topic. So, the topic for today is preconceptional counseling. Now, what exactly is preconceptional counseling, and what is the importance of going to a doctor, going to an obstetrician, going to a gynecologist for this kind of a checkup and this kind of an advice? Is it actually necessary? Today, I would be highlighting the importance of this kind of a checkup and why it is so essential for all women, all couples rather, who are planning a pregnancy to visit their obstetrician as at the earliest in case they are planning a pregnancy or in case they plan to pregnancy in case they want to plan a pregnancy after some time. So, pre pregnancy counseling or preconceptional counseling is a counseling which we offer to any patient who is going to plan a pregnancy in the near future. Now, what exactly is this and why is it so relevant, especially in today's scenario? When you are going to visit an obstetrician, maybe for the first time, or maybe for the second time, or maybe just seek some kind of advice regarding this topic, first of all, your weight is something which is of paramount importance in case you are going to plan the pregnancy. Now, why is this so essential? The body mass index of any patient has definitely a deep impact on the outcome of her pregnancy. In case your body mass index or the height to weight ratio is something which is more, in case one is overweight or in case one is obese, you will tend to fall into a lot of complications during your pregnancy, or you may even have difficulty carrying the pregnancy. Even getting pregnant might itself become a task in this kind of a scenario. So, friends, in case your BMI is more than 24.5, which comes in the overweight category, or in case you fall into the obese category, do visit your obstetrician before you want to embark on this pregnancy journey. The most important reason for this is that in case one is having a weight which is more than what is the optimum required, conception might become a problem. In case one does end up getting pregnant, then you might end up with many lifestyle problems like diabetes, or you might even have difficulty in carrying the pregnancy. Premature incidence, the incidence of prematurity definitely becomes more and more in case one gets pregnant when one is overweight or if one is obese. Also, chances of ending up in a cesarean section or chances of clots getting formed in your legs or clots getting formed in your body in the placenta are much more. So maybe your doctor might even have to put you on injectables or blood thinners throughout your pregnancy in case your weight is more than the optimum. But this is the advice which your obstetrician would be the best person to advise you. So, first of all, very important to know is about your weight and how you're going to keep it under check in case it is more than what is actually required. If you are overweight or in case you are obese. And how much weight you have to gain throughout your pregnancy is something again which your obstetrician would be the best person to guide you. It is not that a blanket that every patient would be advised to gain 10 to 12 kgs. I've seen many patients coming to me and saying that, doctor, we have read somewhere that we should be putting on 10 to 12 kgs in this pregnancy. No, in case somebody is weighing around 90 kgs, which is falling in the obese category, then you are not advised to gain much weight in case you do end up getting pregnant in the near future. So, very important again and again, I'm emphasizing that you have to visit your doctor regarding your weight, and she would be the best person to guide you as to how to go about controlling it once you do end up getting pregnant. The next thing is nutrition. Again, nutritional status of the mother, not just the weight, is again something which is very, very important for every couple to know. In nutrition, the most common factor which I have seen in most Indian women is anemia. Anemia means in case your hemoglobin is less than 12 grams in any lady, that means that she is anemic. And usually during pregnancy, the hemoglobin does tend to fall. So, in case the hemoglobin is going to fall in pregnancy, you have to start your pregnancy with a hemoglobin which is above 12. So, your diet would be advised accordingly so that in case, even if the hemoglobin does fall during your pregnancy, you and your baby are not affected. Because in case the hemoglobin falls to less than 10, then chances of bleeding, chances of dizziness, chances of less blood pressure are very common. Also, you might even bleed excessively once you go in for the delivery, and this may be again difficult to be controlled, and even blood transfusion might be required. So, as a blanket, I advise all my patients to take iron supplements the moment they start their at the end of the third month of their pregnancy. But before that, their hemoglobin level has to be at an optimum level, that is at least above 12. Okay, now the next important topic for all women, which is again very important to know, is your thyroid problems. These days, I have seen the incidence of thyroid is increasing in most women, and most women are not even aware that they are having this kind of a problem. So, getting your thyroid under check again is very important. The most common thyroid problems which women can have, which they can encounter, is either the hypo type of thyroid or the hyper type of thyroid. In the Indian scenario, the hypo type of thyroid is something which I've seen is more common than the hyper form of thyroid. Now, what bearing does this low levels of thyroid hormone have on the pregnancy and on the developing fetus? As we all know, pregnancy specific ranges for thyroid are different from non pregnant ranges. So, getting a thyroid checked before you embark on a pregnancy is very, very important so that in case one does get pregnant and the thyroid levels are initially at a higher level, medication can be started at the earliest and then they can be adjusted to the pregnancy specific ranges for the thyroid, for the thyroid stimulating hormone or the TSH or the T3 and the T4, which I advise all my patients to undergo. So, getting a thyroid check again is very important. Now, what exactly does a thyroid have on the developing baby? Okay, we are giving it for the mother's health, but what exactly is the problem which can arise in the fetus? In many studies, it has been seen that in case a thyroid level of a lady is not controlled, because the fetus is unable to manufacture its own thyroid after the third month of pregnancy, and in case the thyroid is not adequately controlled, then it can have a drastic impact on the mental health of the lady. So, it is very important for every pregnant lady to have her thyroid levels under control, get them adjusted to the pregnancy levels. The pregnancy levels, mind you, are different from the non pregnant levels, and only then she should be getting these TSH levels done every 6 weeks or every month as her doctor is advising her. And the thyroid medication is not to be stopped throughout the pregnancy or even after that because it is going to affect your health. In case you do stop it after your pregnancy is over and you presume that this thyroid was only because of the pregnancy, no, in case you are taking pre existing medication for thyroid, thyroid problems can persist after you have delivered. And so it is very essential for you to speak to your obstetrician openly about your problem, come out with the kind of, problems which you might encounter, like excessive sweating, excessive weight gain, or palpitations, a lot of dizziness. These all are symptoms of thyroid problems. It might be a hypothyroid or it might be a hyperthyroid. So, friends, very important again, when you go for a preconceptional counseling, your thyroid levels would be checked and you would be given medication according to the level of TSH which is present. Now, another very important factor, yes, diabetes. Most women are not even aware that they are having a diabetes problem. And in case this problem is detected during pregnancy, it is something which is called gestational diabetes. But in case the problem is pre existing before, that means that you are diabetic before you have, maybe you are diabetic before you have conceived. So it is very, very important to keep your sugar levels under check. The HbA1c levels should be around between 6 to 7, and anything which is more than 9 is found to have a detrimental effect on the health of the developing fetus. Why is this so? Because excessive sugar has a bearing on the development of the heart of the baby. It has a bearing on the developing skeletal musculature of the baby. So it is again Very important to have your HbA1c levels at an optimal level, and the medication has to be balanced accordingly. Now, once you get to know that you are pregnant, then your doctor would be shifting you to certain oral hypoglycemic agents or anti-diabetic medications which are safe for you and for your baby, keeping your blood sugars under check. So important to know is keeping the HbA1c under control, taking medications once you get pregnant, which are absolutely safe for you and for your baby, and a proper role of nutrition and exercise to control your blood sugars, along with a detailed diet chart, proper dietary modifications. These are something which are very, very important to be brought under control once before somebody embarks on the pregnancy journey. So, friends, coming to this very, very important topic of diabetes. Again, when you go to your doctor, she would again be screening you for many genetic problems. What kind of genetic problems are anticipated? Now, see, in the Indian scenario, the most common genetic problem which I have encountered, especially in North Indian belt, is thalassemia minor. So, we usually do a blood test for all women to see whether they are having low hemoglobin levels, which might be because you are probably carrying a defective gene, because of which your hemoglobin will not go above a certain level. This is called thalassemia minor. In case you turn out to be thalassemia minor and you are told that your hemoglobin is going to remain low, which is bound to go lower down during your pregnancy, then it is important to test the partner also. Because in case your husband also turns out to be thalassemia minor, then the chances that the baby is going to be thalassemia major is 1 in 4 or 25%. So just realize this totally unavoidable situation in case your husband turns out to have some kind of a hemoglobin defect, especially thalassemia minor, then once you do get pregnant, and once the pregnancy test has turned out to be positive, certain genetic tests would be seen to see whether the baby is going to have thalassemia major or not. So thalassemia major is something which is actually I would say a problem which is going to persist throughout the child's life, and it can be managed only by blood transfusions, repeated blood transfusion. It leads to growth problems, it leads to a lot of stunting. So imagine this totally unavoidable scenario, which can be done if you just go to your doctor, get your hemoglobin checked, and also in case you get your thalassemia screening done and find out whether you are carrying the defective gene for thalassemia or not. Another important thing in the preconceptional checkup, again, very important, is blood pressure. These days, I have seen that most women are, in their early 30s or in their late 30s, and because of their lifestyle, they are having a lot of lifestyle problems, hypertension being one of them. And mostly women do come to me saying that they are on some kind of antihypertensive medication. So, can this antihypertensive medication be taken during pregnancy? See, there are very few antihypertensive medication or medications which are given to control the blood pressure, which can be given throughout the pregnancy. So, in case you are on any kind of medication for high blood pressure before you get pregnant, please tell your doctor about it. Come out openly so that she can advise you as to which medication you can switch over once your pregnancy test comes out positive. Because again, very few medications can be given to the pregnant mother so that they don't have an effect on the developing fetus. So, another very important point is keeping your blood pressure under control by suitable medications in case you are having pre existing high blood pressure. And if you're going to tell your doctor about the blood pressure levels and about the medications which you have been taking, she will definitely switch you to safer medications once your pregnancy test turns out positive so that the baby does not have any problems with these antihypertensive medications. Okay, another very, very important scenario is Once your doctor would be having a detailed discussion with you, she will probably be able to detect any kind of chronic medications which you have been taking. These days, I see many patients coming to me with anxiety problems, with panic disorders, inability to sleep, lot of panic attacks, and I do tell them that in case you have been taking these medications before you have had a pregnancy, then please, it is important to totally stop them if your problem is under control once your pregnancy test again turns out to be positive. The most important reason for this is that most anti anxiety medications and antidepressants or medications given for panic attacks or medications which are given for inability to sleep or for some kind of an obsessive compulsive disorder, these medications are not safe in the developing baby. So, which medications can be given? Rather, I would rather send them to a psychologist for a proper counseling so that the medications can be switched off to a absolute minimum or they can be totally stopped once the patient starts to kind of try for the pregnancy. And again, yoga and meditation, exercise does play a vital role in controlling lot of lifestyle problems. The most important reason for this is that once you are doing good exercise, once you are going for a walk every day, or in case you are active physically, there is release of certain happy hormones, and the release of these kind of happy hormones leads to a feeling of well-being. It leads to a kind of a blissful scenario in the patient, and because of which conceiving again is easier. And again, these kind of happy hormones are something which go ahead and relieve your stress to a large extent. So again, how to manage a stressful lifestyle, especially in the middle of this COVID pandemic when everybody is very stressed out because of their job problems, because of their lifestyle problems, because of work pressure at home, with the family, or in office. This is something which, again, your doctor would be counseling you about. Now, what exactly medications would be given in case you are going to embark on a pregnancy, and what is the ideal gap between two pregnancies which a patient should be keeping. In case a patient wants to plan a second pregnancy, I would tell them that the ideal time gap would be 2 to 3 years, irrespective of whether it is going to be a cesarean section or a normal delivery, because this gives you enough time to recoup and also it gives you enough time to spend with your newborn. And once the baby is sort of manageable, it is going to be easier for you to go ahead with your second pregnancy. And what all medications would I be advising to any patient who is going to plan a pregnancy? Uh, besides the tests which I have told you about sugar, about hemoglobin, about genetic problems, the most common of these being thalassemia minor, and about blood pressure medications or any other chronic medications which the patient might be on. Some kind of chronic medications for things like epilepsy. Again, mind you, the epilepsy is something which needs to be well controlled before a patient decides to plan a pregnancy. The reason for this is that episodes of epilepsy are very, very common in pregnancy because the threshold of the seizures is lower to a minimum. And only one or two medications can be given safely. So important is to control the seizures by optimal medication, and use of only one medication for the pregnant lady is something which is advised to all epileptic women, because more than one medication is not something which is going to be safe for the baby or for the mother. So, in case you are on any kind of chronic medications, like for any kind of a mental problem, or you're having some kind of a lifestyle problem, or you're having certain diseases like epilepsy, it's important for you to tell your doctor about these medications so that your problem can be controlled to a large extent. Very important thing to remember is that all the medications which you would be taking during your pregnancy have some or the other bearing on the baby's physical or mental health. And the mental health of the baby is not something which can be picked up by any diagnostic procedures or any ultrasounds or any kind of a physical examination which is done for a patient during her pregnancy. So friends, please do visit your doctor and come up with your problems. Also, the kind of medication which I would be advising all pregnant women is folic acid. The dose of folic acid, which is recommended to all women who are planning a pregnancy, is 400 micrograms per day. Uh, Folic acid, now, why exactly is this medication recommended? The main reason for recommending this medication is that folic acid leads to proper development of the skeletal system and leads to less of neural tube defects or defects in the skeletal system in the developing baby, and also leads to less incidence of cleft lip and cleft palate. So folic acid is one medication which your obstetrician would be recommending. The second preconception advice which I would give to all patients is to be physically active. Uh, Keep your diet uh, as a proper, healthy, balanced diet. Take as least of stress as you can, and also, in case you are taking any kind of medication, they should be reduced to a bare minimum when you are planning for a pregnancy, and they should be switched on to much safer drugs once the pregnancy test comes out to be positive. So I hope this session of mine is something which have cleared all your doubts and all the myths regarding what is the importance of a pre-pregnancy counseling for any patient who is planning a first pregnancy or who wants to know what is the ideal gap between two pregnancies, or who wants to know as to how she should go about in a manner in which the pregnancy outcome is the best for her and for her baby. Now I'm open to all questions which the audience might be asking me. In case you are unable to ask me the questions now, you can message me on the number which is given in the talk uh, in the uh, sidebars which are coming, and you can please ask me your doubts. I'm open for consultations at Cloud9 Hospital, Sector 14, daily, Monday to Saturday, 9 a.m. to 4 p.m. Now, the first question, yes, the first question comes from Radhika. Radhika shares that she is 27 years old and she is planning to start a family, but she is feeling scared. Can you tell me if pre-pregnancy counseling can help in reducing the complications? Yes, absolutely, Radhika. Now, most patients have a lot of fear about the pregnancy in their mind. The moment they feel that they are going to plan a pregnancy, they have so many unwarranted. The word is unwarranted doubts and fears in their mind as to whether they would be able to get pregnant easily, whether they will be able to carry the pregnancy in a smooth manner, and whether the delivery would again be smooth or not. So, pre pregnancy counseling goes a long way in helping you to clear all your doubts, your myths, and the rapport which you're going to build with your doctor is something which is going to, it's going to be somebody who is holding your hand throughout your pregnancy, guiding you, answering all your queries, which your family members may not be able to answer for you. Of course, your family members are there to give you emotional support, but the kind of medical, you know, uh, queries which your doctor can solve for you is undoubtedly something which nobody else can do for you. So, pre pregnancy counseling goes a long way in resolving the patient's anxieties and the myths and doubts which she has in her mind. I hope that answers your question, Radhika. Any other question, please? The next question comes from Ranjana. Ranjana says that she is trying to conceive for a while and she can understand it better only if you tell her as to what are the objectives of a pre-pregnancy counseling and how exactly does it help. Now, Ranjana, from your conversation, you tell me that you are unable to conceive for a while. Now, a while for a woman, for a couple rather, might be 2 months or it might be a year or two. So, this time lag, while, is something which is holding different meanings for different people. In case you've been planning for a year and still you're not able to conceive, then please do go visit your doctor, find out the reason as to why you are not getting pregnant. And a good pre pregnancy counseling with your obstetrician will go a long way in again telling you as to what are the factors which are actually holding you back, or what are the factors which are kind of, I would say, not allowing you to conceive. So having a good pre-pregnancy counseling actually aims to tell the patient, allay her anxieties, and tell her as to how long she can wait before she seeks medical help, medical active intervention. A pre-pregnancy counseling is not an active intervention. I am only going to counsel the patient as to what all things she can do, how she can change her lifestyle, how she can keep her weight under control, how she can manage her lifestyle diseases like high blood pressure, diabetes, or chronic diseases, how she can get rid of the stress in case she is encountering any because of her workplace, because of her family pressures, or because of any other factors. But if any active intervention is to be done, like finding out the actual reasons for inability to conceive, is something which again a pre-pregnancy counseling will tell you when to come back and to seek active help in the form of different tests to see why you're not able to conceive, different interventions to see as to what is the problem line, really goes a long way to help you out. So I hope, Ranjana, this answers your question. Now, the next question comes from Shilpa. Shilpa asks me that in case she has diabetes and she has always been skeptical about conceiving, will it have any implications on her pregnancy outcome? Now, Shilpa, as I have mentioned in my talk, diabetes is something which every woman should be aware about as to what are the problems which one can encounter in the fetus in case you get pregnant with uncontrolled sugar. The HbA1c levels are something which help to see the diabetic control of any patient. But in case your sugars are very much under control and you do manage to get pregnant, then very important is to switch over to safer medications. Now, look, Shilpa, important to know is that not all anti-diabetic medications are safe for you or for your baby. Again, whether your sugar can be managed by diet or exercise, this most women feel that they will be able to do so might not actually be true in all scenarios. So your HbA1c levels should be between 6 to 7, and you should be on medications which are totally safe for you and for your baby once you do have once your pregnancy test comes out to be positive. So uh, in case your sugar is well controlled, chances of having adverse effect on the pregnancy are reduced to a large extent. But of course, with proper supervision of your doctor and with regular sugar monitoring, your outcome of pregnancy can be excellent. I have seen in most patients who are very compliant with the kind of advice I give them in case they are diabetic before their pregnancy or diabetes is detected during their pregnancy. So I hope this answers your question, Shilpa. Now, the next question comes from Nandini. Nandini says that she just got married and it's been a year and she wants to have a baby. Can you suggest the right time to go for pre pregnancy counseling? See, Nandini, ideally, a pre pregnancy counseling should be done once you decide that you want to plan a pregnancy. So, in case you feel that you want to plan a pregnancy in the near future, you should go and meet your obstetrician and get a pre-pregnancy counseling done, because like I have said, eliminating lot of factors in your health, explaining about proper weight gain before you're pregnant, during your pregnancy, diet, exercise, goes a long way in achieving a good outcome and a good optimum outcome in the pregnancy. So, in case you are planning a pregnancy, the best time to meet your obstetrician is as soon as possible, I would say. Any other questions? Okay, so thank you so much, dear friends, for joining me for today's session. I hope that I have been able to answer all your queries. And in case you have any queries, you can always get in touch with me at Cloud9 Hospital Sector 14. I'm available there every day. Uh, you can even ask your questions on my website, drritusethi.com. I would be more than happy to answer your doubts, solve your queries, and give you any kind of advice in case you are seeking help from me. Next week, we would be back with a topic related to gynecology because I would be doing an alternate gynae and obstetrics talk every Thursday at 6:30 p.m. So, if you would like to give your suggestions about some topic which you would like me to speak about, please go ahead. You can drop your suggestions on my website page. The next topic would be announced soon. Have a good day, and thank you so much for joining me for this session.